Welcome to Independent Sources. I'm Gary Pierre-Pierre.
And I'm Vianora Vinca. African Americans make up only 12% of the U.S. population, yet the group represents about half of the HIV and AIDS infections in the country. Over 60% of the new HIV cases among women are African Americans who contract the disease through heterosexual contact.
On this edition of Independent Sources, we tackle the sensitive issue of AIDS among black women and what's contributing to these escalating numbers.
We examine how healthcare reform can address the growing divide between people who can and cannot afford to pay for their medical bills.
Then, we take a look at how the ethnic media is getting some insight on covering healthcare reform and the impact this may have on the immigrant communities they serve.
And we profile a Nigerian reporter using the internet to combat corruption in his country. Those stories and news of the week when we come back.
A lot of mainstream media don't know what is happening in the different communities, and it is up to the ethnic media to highlight their respective communities. That is very, very, very important.
I think it's atrocious and it needs to be addressed. I think a lot of it comes from them being too not caring, more trusting with their men, especially black men. They're very promiscuous. From the slave days, actually, they were actually used to breed, especially the Mandingo type men, used to breed, and it just stemmed down, just went down in the timeline.
I think it's very upsetting, it's very alarming. Myself being a black woman, it's just terrifying. It's terrifying to think that we're spreading this amongst ourselves so rapidly. It's outrageous.
The problem needs to be addressed, and hopefully the healthcare changes can perhaps address that, although it seems like a monumental problem, but hopefully something can be done.
For years, there's been speculation in the media that black women are at high risk of contracting HIV/AIDS because of black men on the down low, or men who identify themselves as heterosexual but maintain closeted gay relationships. But a recent study from the Centers for Disease Control has effectively debunked this idea. The study found that male partners who engage in high-risk behavior, such as drug use, are the major cause of infection for black women. With us to discuss the issue are writer, activist Kenyon Farrow and Alicia Heath-Toby, Program Director in the Women's Institute at the Gay Men's Health Crisis. Welcome.
Thank you. Thank you.
Kenyon, do you think with these new statistics, the issue of men on the down low will be dealt with effectively?
I hope so, that the issue of men on the down low and its relationship to the HIV epidemic in black women will be dealt with, but unfortunately, far too many times I hear on popular, black radio talk shows, the myth still being propagated. And even though, so the CDC just came out with this recent sort of definitive statement, there have been other reports that have come out in the last few years that have also spoken to the same issue, that it's not the issue of men on the down low that's creating the epidemic in black women as we see it. However, we still see the same kinds of conversations happen. So I think there has to be a lot more sort of public education work in the black community to sort of finally put that myth to bed.
Alicia, do you think these new figures will lead to new ways of addressing the issue of AIDS among black women?
Well, I think that there are two issues. One, I'd like to piggyback on what Kenyon said around the pathology around HIV, African American men who have sex with men, and the pathology as it relates to women of African descent. And we have too often, as he has said, heard the notion that it is the black MSM's fault that women of color are becoming infected. MSM, men who have sex with men.
Okay.
Excuse me, I'm sorry. That's the jargon we use in the field. So I think that he's absolutely right, that we first in our community have to eradicate that kind of pathology. That there needs to be continued education around this whole notion of sexuality and identity. And, you know, we have a hard time talking about sex in our communities. And that is, you know, the stigma around sex and the taboo associated to sex is what really drives the epidemic.
Okay.
And so that's where I think we really have to take a gut punch at. You know, this notion of that sex is bad if it doesn't look this way, if it doesn't look like man, woman, you know, that it's bad. And when we have that kind of discussion, we really will get at the root of having more of an open discussion around how people have sex and more about how to protect ourselves as opposed to who we having sex with, but to really look at the risk factors associated with the behaviors that we're engaging in. I think that African American women, you know, in the Women's Institute, we really are driving home the message of self-empowerment, you know, really feeling empowered to take control of your body, to take control of, you know, your relationships, and to engage your partners, be they women or men, in conversation about the history. You know, what's your history, and embrace that.
Kenyon, we've all heard the notion that, you know, this whole download phenomenon was a way to emasculate black men. Do you agree with that?
No, I think what's really interesting about the part of the Men on the Down Low conversation about, you know, issues of masculinity in the black community, and I think a lot of what we hear from people who understand in the black community that there's something problematic about that conversation. So you'll hear people say, well, you don't hear them saying that, you know, the former New Jersey governor Jimmy Greavy was on the down low, or you don't hear them saying, you know, other kind of white figures.
He came out as a gay American.
Right, yeah, he came out as a gay American and was, you know, having, you know, an affair, you know, though he was married and so on and so forth. But the down low as a pathologizing or criminalizing identity was not attached to him, right? I think because of both race and because of class, right? So, but I think what we have to do, I think, further in the black community is to, you know, as Alicia said, point to sort of get rid of our anxieties around black masculinity, to sort of look at a range of different types of masculinity that exist, or men that exist in the black community, some gay, some not gay. You know, I have straight friends who don't fit into what people perceive to be sort of straight man, kind of straight black man, kind of, you know, and often
macho men.
Yeah, they're not macho men, right? And they've gotten called, you know, faggot and other kinds of words by people in the community because they don't fit those norms as well. So I think a more comprehensive and robust conversation around sex and sexuality, around gender identity, and so on, would go a long way to kind of decreasing homophobia in the community.
So is this about homophobia in the black community, or is it about sort of like the media getting this thing wrong? I mean, I remember hearing about this about a decade ago. So Noilyn Harris, the late author, most of his novels were about the central character was a man on the down low, and then the New York Times picked it up, and then after that, the rest, as they say, is history. Do you think now there'll be a more sober discussion about the issue, or do you think the stereotype is much better than the reality?
I think that it's a combination of both. I think that homophobia is unfortunately woven in the black culture. I also think that media drives the messages that we've received as well. I think that our community really struggles with the hardcore conversations. I think the ways in which we are socialized is also, as Kenyon pointed out, the way in which women are socialized to be very good little girls, don't do this. And very similarly, boys are, you know, you have to be a man, and this is what it means to be a man. And anything outside of that neat package, if you will, drives these kinds of frenzies around who is responsible for HIV in our community. And I often think that it takes it out of, and what the media has almost done is almost taken it out of our hands, almost made us not take a responsible stand around it. It's been convenient for us to ride the bandwagon, if you will, of it's the MSMs or the down low phenomena that has driven, when in fact we really have to take responsibility. And I think that, you know, women and African American women and men, we can do that. I think we just don't hear enough of that kind of affirming dialogue on this topic.
You know, when AIDS came out in the early 80s, when we knew about it, it was a political sort of disease, if you will. Then it became a socio-economic disease. Where is it now?
Well, I think the tricky thing about, you know, HIV when it started, you know, it was first identified as the gay cancer, right, and then gay-related immune deficiency, and then finally human and there were, so I think a lot of the work that was done by a lot of early AIDS activists to destigmatize the disease, to say it's not just a gay disease, to sort of do the kind of public health work to let everybody know that any person could, in fact, contract HIV. But I think what happened was we didn't pay enough attention to the specific communities and locations that were becoming disproportionately impacted, so that, in fact, HIV, you know, you could argue is a black disease in the U.S. in this moment, and perhaps globally is a gay disease in terms of the burden of HIV. And so it is actually, at this point, is a socioeconomic disease because it has traveled the same routes of discrimination and oppression, not only in the U.S. but globally. And until we understand the relationship between poverty, between homophobia and racism and sexism and one's disproportionate vulnerability to HIV, I don't like to talk about risk, I like to talk about vulnerability to HIV, that until we begin to do that sort of work, and I think people doing work internationally have taken that on, but we're just beginning to really look at that in the U.S. as those issues.
One of the alarming statistics that I've come across is that 64% of women carriers of the disease are African American. What's your organization doing to address this problem?
Well, one of the things I want to first do is kind of correct the language. The language that women are carriers is a prime example of the kinds of things that drive, right? Or pathologize, right? So that's first of all. And the second thing is that, you know, GMHC, you know, is one of the oldest AIDS service organizations, and it's always, its primary goal has always been about, you know, educating, prevention, you know, and education is the key to all things. You know, they say, you know, if you waste the mind, you waste a future, right? And so, you know, GMHC, we are really steeped in educating people, African American women, around what drives the epidemic. And as you said, there are structural issues that often don't get talked about, like poverty is a driver of HIV in the black community, particularly for women.
There's certainly a lot more to cover, but we'll have to cut the discussion short for now. Alicia Heath-Toby, Kenyon Farrow, thanks for coming in today. Now here's Aisha Al-Muslim with some other news. Thank you.
Thank you.
Thank you.
Thanks, Gary. Here's a look at some headlines from the ethnic media. From the Amsterdam News, black community leaders blame 3 black clergy for Bill Thompson's loss of the mayoral seat. A New York Times article published in October said 3 top black pastors received payouts from Bloomberg in exchange for endorsements. This led some black community figures to speak out against the accused. Pastor Floyd Flake of Greater Allen AME Church in Queens, A.R. Bernard of Christian Cultural Center in Brooklyn, and Reverend Calvin O. Butts III of the Abyssinian Baptist Church in Harlem. Their congregation combined equals about 50,000 people, the same number of votes that Bloomberg won by. From the Filipino Reporter, President Gloria Macapagal Arroyo of the Philippines signed an anti-torture act after Secretary of State Hillary Clinton expressed concerns over the state of human rights in the region. The landmark law bans secret prisons and solitary confinement in detention places, even during times of war or political instability. Persons found guilty of torture can be imprisoned from 6 months to a lifetime. From the Forward, Residents in the village of New Hempstead in Rockland County are protesting a large kosher slaughterhouse to be placed across the street from their houses. Residents from the area have complained about the odor of decaying flesh and ammonia from an existing slaughterhouse in the area. The proposed slaughterhouse has played into larger tensions about the growth of the all-Hasidic village of New Square. And finally, the Italian Tribune has collected $65,000 to help the town of L'Aquila in Italy after an earthquake shook up the region in April, killing about 300 people. The money will help pay for the reconstruction of the San Salvatore Hospital. The newspaper will continue to collect donations for the project under the Italian Tribune Earthquake Relief Fund. Those are just a few headlines from the ethnic media. Back to you, Vianora.
According to the American Journal of Public Health, 45,000 Americans will die this year because they can't afford to pay for the medical care they need. Those sobering statistics are sure to come up as the U.S. Senate begins deliberating on a comprehensive health insurance reform strategy this week. In the meantime, that chasm between those who can and cannot afford health care seems to be growing. Judith Escalona filed this report on two New Yorkers standing on either side of that divide.
Our citizens are outraged by practices of taking away insurance when
the clock is ticking as the Senate debates a bill to reform health care. One of the major sticking points is the public option, a government-run plan that would compete with the private insurance companies. This debate is pivotal for average Americans looking for health insurance, as the line between the haves and have-nots of health care grow thicker and deeper with each passing day. Take, for example, Cecilia Lopes. Lopes is a banker. A native of Brazil, she's an executive at a Swiss multinational bank. She is here in the United States on an L1 visa. She lives in New York City and commands a sizable income. Lopes also carries a package of perks that includes health insurance.
I had an accident surfing, and I hurt my lower back kind of badly. And I had to go to doctor several times. I was giving drugs like painkillers, anti-inflammatory, muscle relax, and I had to do an MRI as well. And I don't know how much any of these things cost because I didn't have to pay because it was covered by my plan.
Have you seen my email?
Luis Perego has a different story.
Okay, no.
He is a documentary film producer born in New York City. The founder and executive director of Sky Features, he produces educational films and works with high-risk youths. He does not have health insurance.
I haven't had a blood and urine analysis test in about 10 to 15 years, and we know what's key to any disease is early detection. So it's something I'm not cavalier about. It's just I can't afford the $300 to $500 expense a month to get my own insurance as a freelance consultant who has his own company.
According to Mr. Perego, the United States continues to be the only industrial power not offering universal health care to its citizens, but willing to wage wars costing billions. On the other hand, Lopes says that her bank's health insurance policy is standard procedure among the Swiss.
For most part, it tries to have like a consistent approach on how to deal with the employees. Of course, it has to be also based on local countries' rules and regulations, but they do try to have a consistent approach to the employees' handbook and benefits and all that.
For working people like Luis Perego, a bill in Congress that will check the health insurance companies through the public option falls short of the ideal single-payer system. The single-payer system, like Medicare, would be a government-sponsored program that would pay for all medical services rendered. It would eliminate the need for private health insurance coverage. Unlike Medicare, it would be available to all Americans. I'm Judith Escalona for Independent Sources.
Some of New York's healthcare reform advocacy organizations are trying to educate immigrant communities about the healthcare reform bill currently going to the Senate. To that end, the organizations have enlisted the aid of the ethnic media. This comes at a time when members of the immigrant and community media are complaining that they have neither the resources nor the know-how to properly cover the issue. And Jeanette Levert has this report.
The reason why we cover these folks is not necessarily because it was...
The New York Immigration Coalition and the New York Community Media Alliance recently held a briefing for the immigrant, ethnic, and community media on healthcare reform. The coalition has worked for over 15 years on this issue. They updated the media on the latest developments and its impact to immigrants.
We really look at the current healthcare debate as a once-in-a-lifetime opportunity to make a real difference, to revamp the entire healthcare system, to make it work for everybody.
Hong says the coalition's goal is to mobilize immigrant communities to take a more active and visible role in shaping the bill as it continues through the Senate. Hong sees the ethnic and immigrant media as a vital outlet for assisting in that outreach.
We see the ethnic media as a partner in educating the public about the policies, but also politically what's happening to our communities, how people are talking about immigrants, and how they're using us to poison the debate.
The briefing highlighted politicians who advocated for immigrant inclusion in the U.S. House of Representatives bill. Speakers also detailed bill items that were unfavorable, such as a 5-year Medicaid wait for new immigrants. Hong and others observed that immigrant inclusion in the health care bill was used as a wedge issue, saying that it bordered on the absurd.
When right-wing opponents of health reform said that, well, we think undocumented immigrants should be prevented from buying private health insurance, paying full price with their own money in the exchange. So I kind of say, well, that's kind of like standing in front of a shopping mall and saying, if you're undocumented, you can't go buy a shirt at Macy's.
Joining Hong were speakers Mike Haney, director of the Metro New York Healthcare for All campaign, and healthcare advocates working in various immigrant communities. The advocates gave examples of how today's healthcare system adversely affects members of their own communities.
There was one community member in particular that felt very sick one day, and she was afraid to call 911 because she had heard from others that it was going to cost thousands of dollars to go into an ambulance. Additionally, she was afraid that if her condition was very bad and that she had to be admitted into the hospital, that there would be additional costs there. So what often happens is our community members forego getting the care that they need, and they would rather do that than be stuck with a bill that they can't pay for.
Before the end of the year, the United States could have a final health care bill. And one of the questions still to be answered is whether immigrants will be included. And Jeanette Levert for Independent Sources.
When we come back, we meet a Nigerian journalist considered persona non grata in his country.
You promised me the world. Is this what you had in mind?
Every choice we make has a consequence. Help EarthShare and its members restore balance to the world. Visit earthshare.org and see what you can do. EarthShare, one environment, one simple way to care for it.
Omoyele Shawari is a Nigerian citizen journalist who has a history of openly opposing his country's government. So much so that he says he's been detained several times and endured many police beatings. Now a world away in New York City, Shawari uses the internet to continue writing about corruption in his country's politics. Adeola Oladele met up with Shawari and filed this report.
There's a place on the internet where anyone can read about the good, the bad, and the ugly in Nigerian politics. SaharaReporters.com was created by Omoyele Sowore, a self-trained citizen journalist. Although he's a Nigerian citizen, he says his country considers him persona non grata.
The government doesn't recognize that I have enough rights to travel into Nigeria like every regular Nigerian because I dare to be different from everybody.
To him, being different means writing to expose corruption and injustices in his country. Omoyele says his website gets more than 1 million page views every month. Some of the stories receive more than 100 comments.
But the reason why the word Sahara came was for a few reasons. One, because I'm fascinated by geographical features, being a geography graduate myself. And secondly, I just looked at it and said, since I'm not a journalist, I'm just like a practitioner of this trade inside the desert where there's really not much hope for success. But I'm going to do it regardless, which means that I'm taking on a challenge that I have no idea how far it will go.
Taking up a challenge is not a new thing for the 38-year-old. He was the president of the student union while a student at Lagos State University in Nigeria. During his tenure, he led thousands of students in rallies against military rule and injustices.
This powerful group will also march along with them.
I had suffered immense torture as a student activist who had protested against the military. I haven't been detained, beaten up by the police and the military.
In 1999, he found a way to fly to the U.S. Then he went on to get a degree in international and public affairs at Columbia University. In 2005, he launched SaharaReporters.com. He also posts the articles on Facebook and Twitter.
Yes, man. How are you? I was trying to check up on a particular record of an individual who probably had a rape case over there. You know, what I just did was to invite all my friends and say, do you have any news? Do you have any information about what's going on in Nigeria? And they say, how do we write it? They said, send me a text message or talk to me on the phone, and I'll sit down and write stories. Then look for some other friends and say, can you edit this story for me, you know?
Omoyele soon faced the challenges of being a publisher. In 2008, he wrote an article that questions the tie between the Nigerian Attorney General and a Nigerian lawyer, Paul Ohi. Ohi sued him for libel and $25 million. That case was later dismissed. And that's not all.
I've had to give up more of my freedom in terms of being able to go to Nigeria. Even in terms of being able to move freely around, because as some of these reports became more powerful, challenges the status quo, and there's been a lot of threats.
His major challenge now is having enough financial support for the website. However, he says he'll find a way to continue because of what he believes.
If you solve Nigeria's problem, myriads of political, social, and cultural problems, it will just infect the rest of Africa almost instantly. And this is what I think the rest of the world doesn't understand about Nigeria.
In other words, as Nigeria goes, so goes the rest of Africa. For independent sources, I'm Adeola Oladele.
Well, that's all we have time for this week. Thanks for joining us.
And remember, be independent-minded.
AIDS is a huge problem in the Black community, with women especially. Men cheat on their wives and their girlfriends. People don't tell about sneaking around, especially with this happening so much more frequently in the community. It just keeps spiraling out of control.
A lot of Black females, as well as Latino, a lot of Anglo-Saxon that they're having is coming up, and it's because a lot of promiscuous sex a lot of days is coming up and people are not learning. I think the community should be teaching them more about the disease and stuff like that so that they more prevention.